Today, we are going to meet Mr. Richard Downs, who has retired recently from Bristol Royal Infirmary Hospital in UK and has been as chief perfusionist over 3 decades in Bristol Royal Infirmary Hospital. He also served as vice president and president of College of Clinical Perfusion Scientists of Great Britain and Ireland. He is glad to share his experience with us. Thank you, Richard. Thank you for agreeing to share your experience with us.
You're very welcome.
You started your career in 1979. How did you come to know about perfusion in those days?
When I left college, I was very fortunate to be employed by the West Midlands Regional Health Authority as a supernumerary student for medical physics and physiological measurement. This involved a split course. It was to do Ordinary National Certificate, ONC, where you spent 6 weeks in the practical setting and 6 weeks at college doing academic work. The course lasted for 2 years, and in that period of time all the students were given a taster of all the areas where medical physics and physiological measurement technical staff were involved. So I was fortunate enough to see renal technicians, respiratory physiologists, cardiologists, cardiac physiologist technicians, medical physics, audiology, and so I completed my 2-year program, and my last placement was at Walsgrave in Coventry to do both the renal technician and perfusion in cardiac surgery. And when I completed my 6 weeks, the then chief perfusionist, Mr. Fred Roberts, said to me that there was a vacancy, and if I was interested, he would consider me to join the team. So I thoroughly enjoyed my time there. So I took the opportunity and I joined them full time at the end of my ONC.
So how was your feeling when you walked into theatre first time?
You must remember that that period of time was the end of 1978, beginning of 1979. So things were very different. So I'd never been into an operating theatre before, so it was quite a raw experience. Even in the UK, in the National Health Service in 1979, things that we take for granted now weren't there. So there wasn't piped gases into the wall, for example. You certainly didn't have uninterrupted power supplies. And from a pure perfusion practical point of view, there were no safety devices, no level detector, no bubble detector. Bubble oxygenators were still being used. No arterial line filters. So it was, and the monitoring was very rudimentary, patient monitoring, very rudimentary. So you didn't have any slave screens or anything.
Just one single monitor.
Just one single monitor, which a cardiology physiologist was sat, and I think the guy was he was a cardiologist, but he was a consultant cardiologist. Basically used to walk around the room shouting out what the blood pressure was and what the heart rate was and whether the patient was in asystole or. So it was very rudimentary.
What kind of changes and experience in perfusion you faced in all your career?
I've been very fortunate. My career has been long, and it's as a cyclist, I would say it's been one hell of a ride. So first of all, the transition from oxygenators, from bubble oxygenators to membrane oxygenators, initially with collarbone membranes, the initial CyMed membrane, and then the transition to hollow fibre membranes, safety devices, level detectors, bubble detectors. When using arterial line filters initially with bubble oxygenators, and then moving down the line from those, transitioning from moving away from bubble oxygenators to membrane oxygenators. Filters of all descriptions, pre-bypass filters, so those sort of things, arterial backup with battery backup, built into heart-lung machines now, uninterruptible power supplies in the network of the operating theatre. So yes, there have been many centrifugal pumps.
So you started your career as an adult perfusionist, and
Yes.
how was it? Was it an easy transition to get into pediatric perfusion, or was it difficult or challenging?
I spent 2.5 years at Walsgrave, very happy years, training as a basic grade perfusionist. I had some excellent mentors. A gentleman called Andy Sutcliffe was a superb mentor and a great role model. But I wanted a new challenge. I wanted to do more, and also I wanted to be promoted. I wanted to get more experience, and an opportunity came to move to Edinburgh, which at the time Edinburgh did both adults and paediatric cardiac surgery on different sites at the old Royal Infirmary in Edinburgh and the old Sick Children's Hospital in Edinburgh. So I moved there in 1981 and again met another excellent mentor, an excellent role model, a gentleman called Keith Sanger, who helped me develop. I was able to learn how to do paediatrics in Edinburgh, and I worked in Edinburgh between 1981 and 1989, and thoroughly enjoyed my time there. Met my wife, and sort of developed as a human being while I was there.
Okay. So life moved on from there.
Life moved on, yes. Grew up a little bit.
What made you to go to States?
In 1989, things were okay, but life was difficult from a financial point of view. At the time, perfusionists didn't get paid very much. Interest rates, as they are now, were very high. It was 15% on my mortgage, and I went to the annual Society of Perfusionists annual general meeting in 1988, and Psychor, who were a private contract group from America, had a stand there, and they were recruiting perfusionists from the UK to go to America because there was a shortage of American perfusionists. And so really all they needed were board eligible perfusionists who were willing to take a chance and go to America. And I was very fortunate in that I was offered several positions, but one of them was at the University Hospital of Pennsylvania, which is a big teaching hospital, Ivy League university. Philadelphia was a pretty city on the east coast of America, and as well as more experience, they offered me a significant increase in salary. So allied to that, it seemed like a good opportunity to improve my CV. Ultimately, I wanted to be a chief perfusionist, and in 1989 in the UK, the only opportunity to be a chief perfusionist was kind of like waiting for dead man's shoes. So I felt as though I needed to have an improved or an excellent CV to get an opportunity to get a chief perfusionist post sometime. And so I thought that going to America would give me that extra experience and another string to my bow, if you like.